After 60. Authority. Life goes on after 60.
If you're over 60 and you leak a little when you cough, rush to the toilet and still don't make it in time, or wake up 2, 3, even 4 times a night to pee, you might feel embarrassed, alone, or think it's just part of aging. But continence experts now warn that urinary incontinence is a major cause of falls, broken hips, depression, and social isolation in older Australians. And the most shocking truth is this: in many cases, it's fixable. Today, you'll discover the 7 silent bladder mistakes that 1 in 3 seniors make, why almost nobody talks about them, and the simple fixes that can give you back dry nights, confidence, and freedom.
There's a health problem affecting millions of older Australians that almost nobody talks about out loud. Not at the dinner table, not with friends, and often not even with their doctor. Yet it ruins sleep, kills confidence, and quietly controls where you go, what you wear, and how far you are willing to be from the nearest toilet. I'm talking about urinary incontinence, unwanted leaking of urine. And if you're over 60, this episode is especially for you. You might be surprised to hear the real numbers. Incontinence organizations estimate that around 1 in 3 adults in Australia lives with some form of bladder or bowel control problem, and rates are even higher in people over 65. In women, pelvic floor weakness and menopause, and in men, prostate problems further increase these risks. But the real problem is that most people silently endure this, thinking it's normal aging. They don't realize incontinence is strongly linked to increased nighttime falls, especially when you're rushing half asleep to the toilet. Depression and anxiety, from fear of smelling, leaking, or having an accident in public. Relationship strain, avoiding intimacy or travel, and in many cases, loss of independence. Because severe incontinence is one of the main reasons families decide someone can't live at home alone anymore. Yet continence nurses and geriatricians repeat the same sentence over and over. In many people, this can be improved, sometimes dramatically, with the right help. In this video, I'll walk you through 7 silent bladder signs and mistakes that almost everyone over 60 thinks are just part of getting older. You'll learn what's actually happening inside your bladder and pelvic floor, which habits are making it worse, and simple, practical steps you can start this week to regain control. And make sure you stay until number 1, because it's the single biggest mistake that is quietly wrecking sleep, balance, and bladder control in older Australians. Before we dive in, tell me in the comments, how many times do you wake up at night to pee? I personally read and reply to every comment like it's a clinic visit, so don't be shy. Your story might help another viewer feel less alone. Now, let's start with bladder mistake number 7. Mistake number 7. A little leak when I cough is normal for my age. You laugh, cough, sneeze, or lift a shopping bag, and there it is. A little leak. Not a flood, but enough to make you reach for panty liners just in case. You tell yourself, oh well, that's what happens after babies, or I'm in my 70s, what do I expect? That's cold stress incontinence, urine leakage when pressure in your abdomen rises. And although it's common, it is not an automatic, untreatable part of aging. In women, the main culprit is a weakened pelvic floor, the hammock of muscles under your bladder and bowel. Years of pregnancy, childbirth, chronic coughing, constipation, obesity, and simply not using these muscles enough slowly stretch and weaken that hammock. In men, prostate surgery can have a similar effect. The key thing to remember is this: muscles can be trained at almost any age. Studies show that targeted pelvic floor exercises, done correctly and consistently, can significantly reduce or even stop stress incontinence in many older adults. What to do? Learn to activate your pelvic floor properly. Most people squeeze the wrong muscles. Ideally, see a pelvic floor physiotherapist for one-on-one coaching. Aim for daily sets of slow holds and quick squeezes. Just like strength training for any other muscle, avoid just in case peeing every half hour. It actually trains your bladder to become more overactive. This isn't about vanity. It's about staying dry when you laugh with your grandkids or lift the groceries out of the car. Mistake number 6. Rushing to the toilet just in case all day. If you find yourself going to the toilet just in case before every outing, before every phone call, and before every TV show, thinking you're being sensible, I have surprising news. You might be training your bladder to misbehave that a healthy bladder comfortably holds 300 to 500 milliliters. It should give you a clear signal when it's filling, then allow you enough time to get to the bathroom. But when you start emptying at the very first hint of fullness, your bladder learns a new rule. Slightly full equals must empty now. Over time, that creates urge incontinence, sudden, overwhelming urges that are hard to control, sometimes with leakage on the way. What to do instead? Aim for regular toilet intervals. Roughly every 3 to 4 hours in the day. When an urge comes early, pause, sit or stand still, breathe slowly, and do a few quick pelvic floor squeezes when the urge settles. Then walk calmly to the toilet instead of sprinting. You are retraining your bladder, like training a puppy not to pee the second it feels anything. This takes patience, but thousands of older adults have cut their bathroom trips almost in half with these simple techniques. Mistake number 5. Drinking almost nothing in the day to avoid leaking. This is one of the most dangerous habits I see. Many seniors drastically cut back on drinking water because they're afraid of leaking or needing the toilet in public. Some go all morning on just a few sips of tea or coffee. The problem? Concentrated, dark urine irritates the bladder, making urgency and frequency worse, not better. It also increases your risk of urinary tract infections, constipation, and kidney problems, especially in hot Australian summers. Not drinking enough can quickly lead to dehydration, low blood pressure, dizziness, and falls. What to do? Aim for 1.5 to 2 liters of fluid spread over the day, unless your doctor has given you a strict fluid limit for heart or kidney disease. Focus on water. Limit bladder irritants like caffeine, strong tea, artificial sweeteners, and fizzy drinks, especially in the evening. If nighttime urination is a problem, take most of your fluids earlier in the day, tapering after 6 to 7 p.m. rather than cutting fluids altogether. The goal is a pale straw-colored urine, not dark amber. That's the sign your bladder lining is less irritated and more cooperative. Mistake number 4. Ignoring nighttime urgency and rushing half asleep to the bathroom. Waking once per night to pee can be normal after 60. Waking 2, 3, 4 times every night is not something you should simply tolerate. Broken sleep affects memory, mood, blood pressure, and immune function. But the biggest risk is the nighttime dash. Here's the typical scenario. You wake up bursting, heart racing. You jump out of bed in the dark, shuffle quickly towards the toilet, half asleep, maybe dizzy from blood pressure medications. One loose mat, one low step, one slippery bathroom floor, and you on the ground with a broken hip. Falls experts say that nighttime toileting is one of the most common settings for serious falls in older adults. What to change? Make the route to the bathroom well lit, plug in night lights, motion sensor lights, remove all loose rugs, cords and clutter between bed and toilet. Consider a bedside commode or urinal if you have very high urgency or poor mobility. Sit on the bed for a few seconds before standing to let your blood pressure stabilize. Talk to your doctor about medications that may be increasing nighttime urine production, some diuretics, for example, or causing low blood pressure at night. Sleeping through the night is not just a comfort issue, it's a major safety issue. Mistake number 3. Believing nothing can be done because I'm too old. One of the saddest phrases I hear from seniors is, "There's no point. At my age, nothing can be fixed." This belief keeps millions from asking for help, even when effective treatments exist. For example, many cases of urge incontinence improve with bladder training, pelvic floor work, and sometimes specific medications. Stress incontinence can improve with pelvic floor rehab, weight loss, and, in selected cases, minor surgical procedures. Overflow incontinence in men may be due to treatable prostate obstruction. Recurrent infections often respond to lifestyle changes. Vaginal estrogen in postmenopausal women, or addressing constipation. Continence clinics across Australia see people in their 80s and 90s who still gain better control and quality of life with the right program. So don't self-diagnose and don't self-limit. Age alone is not a reason to suffer in silence. Mistake number 2. Hiding leakage from your doctor, especially because of shame. Shame is your biggest enemy with this problem. Many women and men do exactly the same things. They finally see the doctor but leave this problem to the very end, if they mention it all. They tell themselves, there are more important issues, I don't want to waste the doctor's time. They're scared the doctor will say, it's normal for your age, just live with it. Or worse, they don't ask anyone for help and spend years relying on thicker pads and dark clothing, planning every outing around the nearest toilet. But urinary incontinence can sometimes be an early warning sign of more serious conditions, like diabetes, heart failure, nervous system diseases, or prostate problems, including cancer. Certain medicines you already take, for example diuretics, sedatives, or some anticholinergic drugs, can also make bladder control worse. When you go to your doctor, the first step to getting proper help is to be open and specific. Tell them how long you've been leaking, when it happens, when you cough, when you can't reach the toilet in time, only at night, all the time. How much you leak, drops, a small wet patch, or soaking pad and underwear. What medications you take regularly. This information helps your doctor work out whether you have stress incontinence, urge incontinence, mixed incontinence, infection, prostate issues, or something else, and which treatment is right for you. Remember, your doctor talks about this every day with many patients. You are not the first, you will not be the last, and you will not shock them. They're there to help you, not judge you. Mistake number 1. Trying to manage your life only with pads and thick underwear, and now we've reached the biggest mistake. For hundreds of thousands of people, the daily solution looks like this: bigger pads, extra underwear layers, only dark trousers, a spare pair of pants in the handbag or car. In other words, you're not solving the problem, you're just hiding the leak. Of course, absorbent products are helpful and often necessary in the short term. They can protect your clothes and give you confidence to leave the house. But if you only rely on them and never look for the cause, over the years this can lead to skin irritation and infections from constant dampness, social withdrawal because you're afraid other people might smell urine, sleepless nights from changing pads and bedding, and most importantly, the same chain we talked about at the start: falls, depression, and loss of independence. The real solution lies in a 3-part plan. Accurate diagnosis: is it mainly stress incontinence, leak when coughing, laughing, lifting? Urge incontinence, sudden, strong urge and can't hold. Mixed, both? Is there an infection, prostate problem, or a neurologic cause? Targeted treatment: pelvic floor muscle training with correct technique, bladder training and behavioral therapy, changing toilet habits and fluid timing. Medications when appropriate for overactive bladder, prostate, infections. Surgical options when needed, for example, slings for stress incontinence or prostate procedures in men. Lifestyle changes: weight management. Extra weight increases pressure on the bladder, preventing constipation, which puts strain on the pelvic floor. Adjusting fluid intake, not too little, not all at night, limiting bladder irritants. Quitting smoking, which worsens cough and damages blood vessels. Pads and absorbent underwear can be part of your toolkit, but they should be supporting actors, not the main character. They do not replace real treatment. You deserve more than just hiding the problem. You deserve to actually improve it. Bladder Rescue Plan. Practical step-by-step guide. At this point you might be thinking, okay, but where do I actually start? Here is a simple, realistic bladder rescue plan you can begin this week. Keep a bladder diary for 1 week. Write down what and how much you drink, what time you go to the toilet, when leaks happen, what you were doing, and how much leaked. Book an appointment with your GP, family doctor, and take this diary with you. Don't minimize it. Start the conversation clearly. I have a problem with urinary leakage and I'm looking for solutions. Ask for referrals if needed. Depending on your situation, you can ask for a urologist, especially for men, or complex bladder or prostate issues. A gynecologist, for women with prolapse or complex pelvic issues. A pelvic floor physiotherapist, for specialized muscle training. Start a daily pelvic floor exercise routine. Even before your appointment, you can begin gentle pelvic floor work. Several sets of slow holds, squeeze, hold, relax. Several sets of quick squeezes. Spread them through the day, for example, after brushing your teeth, after meals, before bed. Review your fluid habits. Don't starve your body of water. Aim for steady, moderate intake through the day. Shift more fluids to earlier in the day, and ease off a few hours before bed. Cut back on drinks that irritate the bladder, like strong coffee, tea, cola, and artificial sweeteners, especially late in the day. Make the nighttime toilet route safe. Remove loose rugs and clutter between your bed and the bathroom. Add night lights or motion sensor lights. Consider a bedside commode or urinal if you have very urgent or frequent nighttime trips. If your balance is poor, talk to your doctor about installing grab rails or using a walking aid at night. Share the emotional load with someone you trust. Tell a close friend, partner, or family member what you're going through. Simply hearing the words, "You're not alone," lots of people deal with this, and we'll work on it can lift a huge weight from your shoulders. These steps are not magic, and they don't promise perfection. But for many people, they bring visible improvement within weeks. Fewer leaks, fewer nighttime trips, less fear about going out, and more freedom to live the life you want. Now I'd love to hear from you. How many times a day do you go to the toilet? And how many times do you wake up at night to pee? Share your answer in the comments below. I read every single comment because your story might be exactly what another viewer needs to hear to finally ask for help. If this video brought you value, please like it, share it with someone who might be quietly struggling, and subscribe so you don't miss our future health videos for people over 60. Stay safe, stay prepared, and remember, even after 60, your body is still capable of positive change, much more than you think.